are we doing here at Health Freedom 2019? Right on. This is a fantastic event sponsored by a terrific group of people. And today, I get to announce Dr. Blanche Grube, my friend, colleague, and my sister. I am so proud to introduce this lady because she has traveled the world educating dentists on what true biological dentistry is all about. You're going to learn things today that you won't believe are possible to have to do with human health. Dr. Blanche Grube is located in Scranton, Pennsylvania, but she also has a lab in Colorado Springs, which she'll be able to discuss with you. And her booth is out there in the lobby, so you guys need to come and check it out. Dr. Blanche Grube has worked with the history maker of this movement of mercury-free dentistry, Dr. Hal Huggins. And when Dr. Hal Huggins and her developed the Huggins-Grube protocol, it really is transforming dentistry as it should be. May I introduce to you the one, the only Dr. Blanche Grube.
I'm not sure if I drew the short straw here, getting everybody right after lunch. So I'm just going to warn you, if I see anybody sleeping, I'm going to throw something at you, okay? Maybe I'll just bless you, okay, and let you continue sleeping. But I'm very happy to be here, and I'm very happy that all of you showed up. Thank you very much. So what does gum disease have to do with cancer? What does anything in the mouth have to do with the rest of the body? A lot. And that has been the problem. Over the last 150 years, medicine and dentistry have been separated. They believe, the belief was and still is to this day, that your teeth are your teeth, and if you have a toothache or you broke a tooth, you go to the dentist. And it has absolutely nothing to do with the rest of your body. And that couldn't be any further from the truth. Absolutely could not be any further from the truth. So, forgive me, I'm telling you right now, I have 120 slides. There's no way I'm going through 120 slides in 1 hour or less. 50 minutes, I think they told me. Because I have a habit of getting off the topic and just speaking as my heart tells me to speak, as I look out and I see each and every one of you. And the Spirit moves me, and I can just take off and talk for hours until they tell me, okay, doctor, shut up. Okay, so I'm just warning you ahead of time. Let's see. Okay, so we're going to start out with the story of Sam Smith, whose name was changed, obviously. Okay, Sam Smith went to see Dr. Huggins when Dr. Huggins was practicing as a dentist. And, Hal would tell him all the time, Sam, you really need to stand closer to your toothbrush. I mean, he was, you just weren't doing it right. Okay? And out of embarrassment, Sam decided to go to another dental office to have a routine cleaning. Everybody in this room goes every 6 months for your routine cleaning? Yes? Do you want to know where that started? I'm getting off the topic again, aren't I? All right. I was born in 1950s, so I do remember listening to the radio. And there used to be a radio show called the Amos and Andy Show. Hysterical comedy. And the sponsor of it was Pepsodent toothpaste. Now, if you were to go to the drugstore and look for Pepsodent toothpaste, you won't find it. It was taken off the market. Well, one day, Amos and Andy are talking, and then the commercial goes on, and it's something like this, for you people who are my age and can remember. The jingle was, you'll wonder where the yellow went when you brush your teeth with Pepsodent. Here we go. See, somebody else remembers, right? So the commercial is over, and Amos says to Andy, hey, Andy, just how often should you go to the dentist? And Andy was probably scratching his head. Of course, he couldn't see that on the radio. He was probably scratching his head, and he said, well, gee, I don't know. I would say probably every 6 months. That was in the 1950s. It became gospel. You get a cleaning in your dental office every 6 months, whether you need it or not. And what's really bad is that you wait every 6 months when you probably need to go every month. Maybe you need to go every 3 months. Maybe you need to go not at all, which is ideal. You should not go to the dentist. There's something wrong with having to go to the dentist to have a cleaning. Think about it. When was the last time you went to your physician and said, "Hey, doc, I really need a good shower. Could you get the crack in the back? I have a spot over here I have trouble getting to." Now, that, as bizarre as that is, that's about what it is when we go to the dentist to get a cleaning. You're asking the hygienist to do something you should be doing every day? You should be in control of your own mouth. You should be in control of your own health. And if you can't control the 3 inches by 4 inches right here, how the heck are you going to control the health of the rest of your body? Not easy. But the reason we can't do it is because we've been sold a bill of goods. We've been told a lie. And so the name of this conference is Health Freedom Expo. Well, the only way anybody can have any freedom is for them to take responsibility for their life themselves. Not just with health, but with everything. Is that not true? Yes. All right. Yeah, I got somebody here that's going to say amen to that, right? So you have to take responsibility for yourself. It's not the hygienist's job to clean your teeth for 6 months, and now you're good for 600 meals or 6 months, whichever comes first. That is the most bizarre thing. And I thought about that. Well, I've actually been thinking about it for probably over 50 years. Why do we do that? We've been sold a bill of goods that if I go to the dentist every 6 months, I will get a cleaning and I will be in good health. Couldn't be any further from the truth. As a matter of fact, those of you who do go to the dentist every 6 months, unless you have perfect teeth and you keep your mouth immaculately clean, which means you really don't have to go to the dentist every 6 months, if you do go to the dentist every 6 months, you probably have more dentistry in your mouth than you need. You probably have more dentistry sold to you than you have ever needed. And I got another amen on that one. So, standing in front of you right now is the heretic. The one voice, and there are a few others like me, but their voice is a little bit quieter. There are a few others like me, but I'm the one voice that says, wait a minute, it's time that people hear the truth. If you're over 40 and you have a crack in one of your teeth, how many of you think that tooth should be crowned? Raise your hand. Crowned. No. And yet, many times you go to the dentist, the hygienist is the first one to say, "Oh my Lord, Susie Smith, you have a crack here on tooth number 30. I do? Yes. I'm going to tell Dr. Jones about this." So now the patient has heard it once. A few minutes later, Dr. Jones comes in, and she says, "Dr. Jones, could you please take a look at tooth number 30? There's a crack on the buccal." She uses some dental terms. On the buccal, that means the cheek. Now the patient has heard it twice. Then Dr. Jones takes a look, and he goes, "Oh, my, yes, in fact, there is a crack on tooth number 30. Let's take a good look at it." And then they put tooth number 30 on a screen that's this big. And they show it to the patient. And the patient goes, "Oh, man, I got a crack on tooth number 30. We've heard it now 4 times. And the doctor says, "Mrs. Jones, when would you like to schedule a crown for that tooth?" "Well, will my insurance pay for it?" Well, that's lie number 2. I'll get to that in a minute. Let's finish the story about her crack. Because the first question she asks is, "Will my insurance pay for it?" And Dr. Jones says, "Well, we'll have to have that discussion with the receptionist up front, or if it's a real big office, he'll say, with my financial aid officer." Last time I had a financial aid officer was in college. And I liked her because she let me sign away everything until graduation, and she showed me how much I signed away for. Oh. But so a lot of dental offices have a financial aid officer. So you can go speak to the financial aid officer. Well, financial aid officer comes into the office and says, "My Lord, I heard you have a crack on tooth number 30. Well, your insurance doesn't take effect until January 1st. So we're going to have to wait until then, unless you really want to have it done right away and avoid the pain and suffering when that tooth breaks on you." And now this poor lady doesn't know what to do. Geez, should I wait 6 months for my insurance to take effect? Well, Doc, what happens if I don't crown it? Well, could be a sad, sad story. The tooth could crack, the whole wall could crumble to nothing, and you'll have nothing left. It could crack vertically, and you'll be in excruciating pain, and yada, 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 yada. Right. Now, there are some people who say, "But Blanche Grube, isn't that what you do? You scare people into thinking mercury is toxic. You scare people into thinking root canals are toxic. You tell them if they have a lot of root canals, they're probably heading for cancer. Don't you also use the scare tactics?" Yes. Unfortunately, I'm guilty of scaring the patients, except for one difference. I'm not giving them my opinion. I'm showing them the science. Here's the science. Here's the science that says mercury is toxic in every way, form, shape, size, down to one molecule. One atom of mercury kills one cell. That's scientifically proven. Yeah, I'm just the bearer of bad news. Do I scare people and tell them that cancer causes root canals? I'm sorry. Root canals causes cancer? Well, no, I would never exactly put it that way. But boy, is there a lot of science out there that says the microorganisms that are in root canals are the same ones that are in cancer, the same ones that are starting cancer. Well, isn't that interesting? Isn't that interesting that in, I don't know, let me see, it was 1992, I was diagnosed with chronic metablastic leukemia. I had just been to my first Dr. Huggins dental course. This was a class of 60 dentists. You walked into the room, they sat you down, wrapped a tourniquet around your arm, and started to take blood. And I thought, my Lord, have I joined a cult? I think I'm in trouble. But I went along with it. I gave them my blood. And Dr. Huggins spent 3 days talking about mercury, mercury, mercury. At the end of the 3 days, on day 4, he says, "Okay, I'm going to show you guys," I was the only woman in the class back then, "I'm going to show you guys just how sick you all are because you're dentists. So let's take a look at the blood chemistries, which have just come back from Colorado Springs General Hospital, and see just how sick you all are." So my blood goes up first, and he says, "Ooh, we got a sick puppy here. Whose blood is this?" "Mine." He says, "So Blanche, how long have you had cancer?" "Excuse me?" Where do you see that?" He said, "Well, they circled it in red. They wanted you to see it." And they did. They circled it in red quite a few times. And I said, "Well, it only says 1% meta, what?" He says, "Oh, so you don't know much about leukemia, do you?" I said, "No, I don't." He said, "Well, you got 1% metablastic cells," and I'm the total optimist. I said, "Well, 1% is a small number." He said, "Yeah, but," he says, 1% you're sick," and I was. I'd been sick for months. 2% you're in the hospital, and 3% you're dead. And then the most strangest question of all, he says to me, "So Blanche, how many root canals do you have in your head?" And I just met this man. And I'm thinking, wait a minute, we've been talking about mercury for 3 days. why is he asking me how many root canals I have in my head? I said, why are you asking me how many root canals I have? He said, well, you've got cancer. He says, so you probably have root canals. I said, well, yeah, I've got 5. He said, good, you're going to get them taken out, right? Hell no. By the way, I'm a New Yorker, in case you hadn't figured that one out. Hell no. Are you crazy? I literally said that to him. Are you crazy? I says, I'm a dentist. I'm very proud of the fact I have 32 teeth. I plan on going to my grave with 32 teeth. And he said, that's exactly what you're doing. Sooner rather than later. And then I'm scratching my head and going, wait a minute. Have I just been insulted? I'm not sure. I'm not sure. So it took me a few months. I really did not want to ever have a tooth taken out. It took me a few months to continually educate myself. That was the beginning of my journey. And about 4 or 5 months later, I signed myself up as a patient in the Huggins Diagnostic Center in Colorado Springs. I had 18 mercury fillings removed, 5 root canal teeth taken out. My brain fog disappeared the next day, and I didn't even know I had brain fog. Seriously. I just thought, this is the way everybody is. And you know what? I'm not that smart. I really can't read very well. So, that's just the way I am. That's why I decided I was going to become a musician early in life, because I couldn't read. And the next day, my brain fog disappeared. And I thought, Lord, something is different. My head is clear. That droning that I had in the back of my head since I was 4 years old is gone. I quickly grabbed a magazine, because I had taken the Evelyn Wood reading course twice. I couldn't get into English 101 in college. I just couldn't do it. And so the instructor said to me, you should take the Evelyn Wood reading course. Okay. So I took the Evelyn Wood reading course. She taught me how to read with my finger. When I got to the bottom of the page, I don't know what I just read. All right. So I went back. I took the English placement test again, and I failed it again. And the woman said, well, maybe you should take the course a second time. Okay. I took the Evelyn Wood reading course a second time. Took the English placement 101, and you failed it again. Now she's feeling sorry for me. And she said to me, come here. She said, did I hear you say you're a music major? Oh, yes, I play the flute. She goes, okay. I said, so I don't do much reading, because music, is vertical. And we always see something ahead of time. It's never you go in cold turkey to play something. She says, okay. She says, you know what? Promise me you're going to stay on the music side of the campus, and you failed the test by 1 point, so I'm going to give you the 1 point and let you in. Whew, well, that was close. So it gives you an idea how difficult school was for me, how difficult my first 3 years as a music major was difficult for me, because you still had to take English and contemporary civilization. And I really struggled with those courses because I couldn't read. Now, 1993, I'm in Colorado Springs. My fillings have just been removed, and I grabbed the magazine, and I'm a speed reader, because I still knew how to remove my finger. Isn't that interesting? And I'm a speed reader today. I'm usually reading 6 books at a time. My leukemia took a lot longer to go away. 3 weeks. That's a lot longer, right? That's 21 times longer. Took 21 days. All the metablastic cells in my body were gone. And at that point, I made the most intelligent decision of my life. I said, I'm going to follow Dr. Hal Huggins. Every place he goes, I'm going to learn everything he knows. I'm going to say everything he says. I've actually added a few words. And I'm going to do everything he does. And I did that for the next 27 years. And so getting back to cancer, in 27 years in my practice in Scranton, Pennsylvania, we have literally had, hundreds and hundreds of women with breast cancer. Maybe 1,000, I don't know. I've never really added up the numbers. And all different other kinds of cancers. And in all those years, not once have I had somebody with cancer who had the perfect mouth. So can I say that root canals cause cancer? No, I can't say that. But boy, we got something fishy going on here. And there's definitely a connection. We just haven't been able to figure it out until now. Until now, my trusty assistant, Anita, who I call the hound dog, she sniffs out research like nobody's business and says, Blanche, wait till you see this. They actually have discovered the microorganisms that set the body up for cancer. I'm sure some of you have read some of this. Just like, if you had a stomach ulcer, they said, you're too nervous. Stop worrying about everything. Right? Drink some buttermilk. Do something. You're too stressed out. That's what's causing your stomach cancer. Until they found out, hey, guess what? No, it was a microorganism in the stomach that was causing stomach ulcers and then stomach cancer. It's a microorganism that's doing it. And so now we know there are microorganisms that set the body up for cancer. Does it mean that everybody who has those microorganisms gets cancer? No. But if you have those microorganisms and they've set up housekeeping in your body, and you've allowed your body to get run down, you've allowed your immune system to weaken itself by not accepting 100% full responsibility for your health, guess what? You're going to get cancer. And so then this is what we're seeing. Every person that has come through my office with cancer has either a root canal or a cavitation. Every single one. So one day, this lady comes into my office, and she's a second time around breast cancer patient. And like I usually do, I sat down and I said, okay, so we've got breast cancer now the second time around. Which tooth is root canaled? She says, no. Excuse me? I said, which tooth is root canaled? She says, none. Well, 25 years ago, Dr. Huggins had made a deal with us. He said to all of the dentists, if you ever find a patient with cancer that doesn't have a root canal or a cavitation, please send that to me and I will give you $1,000. And I said, oh, baby, you're on. Because I'm a gambling woman. Okay, I like this deal. And lo and behold, 25 years later, maybe 26 years later, this woman comes in and she says, I don't have a root canal. Oh, so you had 4 wisdom teeth removed? You probably have 4 cavitations? No, I have 32 teeth. I've got $1,000. I had that money spent 6 ways till Sunday. Until I did the examination. And she was right, her teeth were all perfect. 32 teeth. I'd never seen that before. And then all of a sudden, I got to tooth number 6. For those of you who are not familiar with the numbering system in dentistry, tooth number 6 is your upper right canine. And tooth number 6 was brown. Like the color of that wall there, brown. And all the rest of her teeth were beautiful white. And I said, have you ever noticed how dark this tooth is compared to your other teeth? She says, yeah, I did notice. She says, oh, I forgot to tell you. They want my $1,000, you bet. That tooth was lying sideways above my bicuspids. And I had it surgically and orthodontically moved from here to there. Well, that's significant because the bicuspid meridian is the breast meridian. So she had a dead tooth in the bicuspid meridian. Just 1 year prior, she had it moved down into this position. And what did that do? It triggered her cancer for the second time. She had it up here to begin with. So she had a dead tooth in the bicuspid meridian that triggered her cancer. There went my $1,000. But it proved a point. No one has cancer with 32 perfectly white teeth. No one. That's how important teeth are. No one has cancer without either a dead tooth somewhere, even if you didn't have a root canal, one of those puppies is dead, or a cavitation, or 4, or 5, or 6. No one. And so the mystery was solved. She had it. Yes? Why would you seal something that's perfect? If it ain't fixed, if it ain't broke, don't fix it. When you seal a tooth, you are putting a layer of resin, and it's not the same resin that we use when we're doing a bonding of a tooth. It's a different kind of resin. These are full of bisphenol A, which is a concern for a lot of people. When you seal the top of the tooth, you are stopping fluid flow from the inside of the tooth to the outside of the tooth. That's normal. All of you are sitting here in this audience, and you may not be aware of it, but you are perspiring. Some of us a little more than others. You are losing fluid from the inside to the outside. That's natural. And if you sat here for 3 days without drinking, you would be suffering from dehydration. Well, it's the same for our teeth. Fluid flows from the inside of the tooth to the outside of the tooth. That's normal. The moment you put a sealant on the top chewing surface of a tooth, you have now stopped the fluid flow. It cannot flow from the inside to the outside. I wasn't even a biological dentist when I noticed, wow, you know the kids who have sealants, they get bigger cavities between their teeth than the kids who don't have sealants. What's that all about? That's line number 3 we've been sold. Oh, you have little Bobby. Little Bobby has some really deep grooves in his mouth. And we better put some sealants. Oh yeah, don't worry about it. Your insurance pays for it. See, that's the problem in this country. You don't get the medicine and dentistry you need. You get the medicine and dentistry that your insurance dictates you need. And they're a bunch of bureaucrats, the insurance companies. They don't know anything about medicine and dentistry. They're just looking at numbers. And some fool comes up to them and says, you know, if you seal these teeth, you'll prevent decay and save the insurance company money. And the insurance company says, oh, okay, well, the sealant is only, well, in the old days it was $15. Now it's probably $60. And the filling is $120. So, yeah, okay, we'll pay for sealants. And the dentists then automatically do sealants on everybody, whether they have deep grooves, whether they have propensity towards cancer or not. Why? Because your insurance pays for it. All right? And why do we call it insurance? It's not insurance, it's a stipend. Insurance is, oh Lord, God forbid, my house burned down, I need a new house. And so you've been paying a couple $1,000 a year, but now you're going to get a $250,000 house because your house burned down to the ground. Insurance is, oh Lord, I parked my car in the grocery store. I went in, when I came out, a truck smashed my car and totaled it. Now you need a new car. That's insurance. Did you ever try going to your dental insurance carrier and say, you know what, I need $10,000 worth of dentistry. I've got to have all my mercury fillings removed, some root canals, and have some new bridges put in, partial denture, whatever. It's going to cost $10,000. And the insurance company says, well, we'll give you $1,500. That's not insurance, that's a stipend. Let's call it what it is. And I went off topic. Anita, where was I?
You were talking about Sam Smith and Al Hawkins.
I was talking about Sam Smith. So Sam Smith, that's right, Sam Smith went for a routine cleaning. By the way, here we go again. I have so much I want to tell you. I can't tell it all in 50 minutes. A routine cleaning is probably one of the most invasive, dangerous procedures you can have done in a dental office. And the more you need it, the more dangerous it is. Because the moment that hygienist starts poking around those gums, she's introducing bacteria into your bloodstream. We have a fancy word for that. We call it a bacteremia. That means the level of bacteria in your blood goes sky high. It's one of the most dangerous, invasive procedures you can have done. And yet we flippantly say, yeah, I just went to the dental office for cleaning. Somebody tells me that, I'll say, you know what, you better take it easy for the next 6 to 7 days. And you better take a lot of vitamin C and don't stress out your heart too much. Because I can't tell you how many people have dropped dead of a heart attack 7 days later after getting their so-called routine cleaning. Yes? Oh, deep level's even worse. That's a surgical procedure. You should be in the hospital for a deep cleaning. No, kidding. Or at least an office that does IV vitamin C and keeps your body protected while you're having a deep cleaning, because you know you're going to bleed. And the moment you bleed, bacteria are entering into the bloodstream. Start pumping the vitamin C like there's no business, like there's no tomorrow. You can't get enough of it. No antibiotics. Antibiotics. Anti means against. Biotics means life. So if you take an antibiotic, yes, it kills a lot of the bad boys, but it also kills all the good boys. You know, they say we've got 6 to 7 pounds of bacteria in our body, and they're our partners. They help us digest our food. They give us vitamins that we cannot produce ourselves. And now they're even talking about, and this is scientific research, they're even talking about the fact that the bacteria create moods in you and give you thoughts. So when you get that urge, I just gotta have a piece of chocolate. I gotta have some. Oh Lord, it's 4 o'clock. I gotta have that chocolate. You know who's talking? You're not talking. It's what we affectionately call in our office the yeasties. Those little yeasties, they want the chocolate and the sugar. So they actually produce a chemical that makes you crave chocolate and sugar. It's not you. You're forgiven. It's the yeasties. So we got the yeasties, we got the fungi, we've got the molds. They're all claiming their turf, and they're all claiming chemicals that make you want to eat the foods that will feed them. Green smoothie? It's not on their list. Green smoothie's not on their list. Not at all. So Sam goes to another dentist. See, that's significant. Because in our office, almost everybody is hooked up to IV vitamin C. We know that what we're doing is dangerous. By the way, the truth is, I hate to say it, but it is true, there really is no such thing as holistic dentistry. You know, I have this conversation with my colleagues all the time. You know, we call ourselves biological holistic dentists. Man, the moment we give somebody a cleaning, the moment we give somebody an injection, we have now stepped out of the holistic world, haven't we? Right? There's nothing holistic about Novocaine. Absolutely not. There's nothing holistic about creating a bacteremia in somebody's bloodstream. Absolutely not. So that's true. But we try to protect our patients in our office by giving everybody an IV vitamin C. So Sam goes to another office. Now he's embarrassed. He doesn't want to see Dr. Hal Huggins. He goes to another office and gets a cleaning, routine cleaning, and 7 days later, Sam died of a heart attack. Oral disease is the most common non-communicable disease and affects people throughout their lifetime, causing pain, discomfort, disfigurement, and even death. That is so untrue. That is so untrue. Who said it's non-communicable? When my kids were in 3rd, 4th grade, I used to lug the microscope to school. And I'd say, okay, who wants to put their spit on the slide? Me. And they'd put their spit on the slide, and I'd put the microscope there and hook it up to a screen so that they could see the little fishies swimming in their mouth. And they go, ooh, Dr. Grube, what's that? I said, well, those are parasites, spirochetes, motile rods, all the bacteria that are in your mouth. And when you kiss somebody, you are sharing. Isn't that nice? When you say, hey, this is really good. You want a sip? Sure. you've just shared bacteria with that person. It is very communicable. If one spouse has periodontal disease, the partner does also. They may be fighting it full speed ahead, but they have periodontal disease also. It is one of the most communicable diseases. Straws, glasses, kisses, you name it. As a parent, I tried very, very hard. I tried to discourage my kids from getting into the homosexual scene early. I was a bad, bad mother. I was a very good dentist, but a bad, bad, bad parent. My boys were not circumcised. And so I told them, this was bad. I've been asked for forgiveness many times. I said, you boys are different than all the other boys. How, Mom? I said, well, we didn't want to cut away any body parts. We wanted you to stay just the way God created you. They go, yeah? I said, so when you have sex for the first time, it's going to hurt a lot, just like it hurts on a woman. So you better really love the woman that you're going to have sex with. And they were like, no, we're never going to have sex. No. So I thought, I got them. Yeah, it only lasted till their 20s. It didn't work out too much. The hormones took over, and that was the end of that. Okay, oral viruses can transfer. It's not just a cold sore. I wish people would stop calling that. Really, herpes, yeah, it's rampant. Everybody's got it. But if you continually get cold sores, it's time to like they say, wake up and smell the coffee. If you constantly get cold sores, wake up and do a check on your immune system. Because these bad boys only show their faces when the immune system's run down. They call it a cold sore, but in order to get the cold, your immune system's got to be run down. Okay? The day you're born, a male is born with an infinite amount of sperm. It's on my list of top 10 questions I want to talk to God about when I get there. Because, they can't take care of the kids they procreate in their 20s. Why are they procreating in their 80s? It doesn't make sense. So a male is born with an infinite number of sperm. A woman, though, on the other hand, is born with just so many eggs. And as many of us know, by the time you hit 45, a lot of those eggs are not so good. So you have a higher incidence of having a child with Down syndrome. It's really interesting, and most people don't know this. Your immune system, your white blood cells, is a finite system also. You were born with just so many copies. I'm on slide 3, so I'm doing well. Your immune system is a finite system, meaning you were born with just so many copies. So it's like, the Xerox guy comes into the office and he says, this is a very fine machine. This machine is good for 1 million copies. Wow, 1 million copies. We're signing up. And before you know it, you're at 999,999 copies. How did that happen so fast? Well, your white blood cells reproduce, and when they make a copy of themselves, it's a good copy when you're young. And when you get a fever as a child, you start making copies. You're revving that copying machine faster and faster and faster. You're using up a lot of copies. And then the kid gets another fever because the doctor has given him an antibiotic. Never did a culture, has no idea what microorganisms are in the ear, but gives you an antibiotic. And so, of course, the infection comes back. Boom, we're revving that machine up. We're using up a lot of our copies. And so what happens? You're now 60, 65 years old, and you get an infection, and it's life-changing, life-threatening. Grandma goes into the hospital at 75. Her white blood cell count is 5.5. It's perfect. But she gets an infection. It turns into pneumonia like that, And they make the phone call, that horrible phone call, and says, Grandma passed away last night. What? Her white blood cell count was 5.5. She was doing fine yesterday. But she picked up pneumonia, and her copies, she was making copies, but they were blanks. Your immune system is a finite system. So my message to you is, if you have a root canal in your head that is full of microorganisms, and there's no such thing as a sterile root canal. If you have a root canal in your head that's full of microorganisms that is constantly feeding into your immune system and your circulatory system, and you are running that copying machine every single day, just know you are running out of copies. And they say it's a free country, right? Land of the free, home of the brave. So that means you can choose what you want to do with your copies. You can either work on a root canal tooth or cavitation 7 days a week, 24 hours a day. You can do that. Or you can save your copies for something serious, like cancer, hepatitis C, something serious. And you don't know when you're going to get exposed to that. But it's your choice. Use your white blood cells to fight this stupid root canal that you're never going to win that battle. Or get rid of the root canal, build up your immune system, and save your immune system for something serious. You walk into an elevator, there's 10 people in the elevator, and somebody goes, Achoo! And all of a sudden, the white blood cells in your lungs go, hepatitis C, red alert, hepatitis C, and right bronchi. He calls up the president of Spring University, and he says, we need 1 million white blood cells on the double, right bronchi, hepatitis C, on the double. And the president of the Spring University says, whoa, wait a minute. You know that root canal in the upper right molar area? We've been losing 50,000 white blood cells every day for the last 10 years. I'm sorry, but we don't have 1 million white blood cells to send to the right bronchi. I'll tell you what I'm going to do, though. Suppose I send you 50,000 white blood cells, and I'll send you another couple of hundred immature cells. They don't know what they're doing, but, we'll send them anyway. This is the scenario that takes place in your body every day. Your body has been programmed to do one thing and one thing only: make you survive today. That's it. Your immune system is not interested in tomorrow. It's certainly not interested in next week. You need to survive today. And so it's going to choose what is the most dangerous thing right now that we need to pay attention to so we can survive today. That's it. Any questions? Because I only have 5 minutes left, and I'm on slide number 3. Yes?
I've heard that if you take out too much of the amount of the dark fillings in your mouth at one time, it can cause a problem.
No, that's not true. No, what's important is the level of safety. She was asking if you take all the fillings out at one time, can that cause a problem? No, we usually do it in one time. As a matter of fact, the whole mouth is done in one day. But the level of precaution that we take is up here. So we really protect the mouth. And if you had a tumor, would you say to your doctor, listen, doc, I just want you to take it out a little bit at a time? All right? Nah, you would never, get it out.
So how often are you supposed to go to the dentist? And if you've got things going on in your mouth, and I've had a root canal and I've had it taken out, and I noticed that things have stopped, but I still feel like there's some other things going on, and I need to know. I have a dentist, a general dentist that I go to all the time.
Right.
But I might need to go into something a little bit more deeper, a little bit more someone that knows, like you,
Right.
as to what's
really going on.
Yeah, what's really going on?
Yeah. Thank you. That's a smart question. I mean, just if your spirit is telling you need more, listen to your spirit. You need more. You need somebody who knows what to look for.
What do you do for cavitations? Like if you have
Cavitation
your-
is an infection in the jawbone. Thanks for
so
asking
if you
that.
get your wisdom teeth, you don't necessarily
Have a cavitation.
or do you?
You're more like 95% of the wisdom teeth extracted are cavitations
So what do
today.
you do for that?
Well, first you have to test to see if you have a cavitation, and if you do, then the gums are cut. We go back into the same hole where the tooth lives and rotor it, this time without epinephrine.
Okay.
That's the difference. Okay, that is the real big difference. Epinephrine, I believe, is really what causes cavitations. Epinephrine is a drug that's produced by adrenal glands, but it's also synthetically made and put in Novocaine carpules. So when the dentist gives you a shot of epinephrine, and the oral surgeons do this, bing, 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 4 at a time, when they do that, they're causing vasoconstriction of the blood vessels, which means they're causing the smallest blood vessels, which are the capillaries, to close completely. And so now those capillaries that are supposed to take oxygen to the bone cell are not doing it. And so now you've got a bunch of dead bone cells. The dentist takes out the tooth, stuffs in some cotton, sends you home, and says, go reproduce. Go make more bone. Well, guess what? Dead bone does not make new bone. Doesn't happen. You may heal up on top where the circulation is better, but not inside. And so now you've got a cesspool that's sitting there for 20 years. The longer the cavitation is sitting there, just like a root canal, the older the root canal, the longer it's sitting there, the more toxic it is. It's a party. It's a hotel condominium for the bacteria. It's a party. So you probably have 4 cavitations. They need to be rotor-rooted, cleaned out, without anesthetic, without epinephrine, anesthetic with epinephrine, and get on with your life and let them heal naturally, which is what's supposed to happen.
Wait. She has some.
Okay.
Thank you so much for all your info. Congratulations, you're wonderful. I have a question about gums and gum disease.
Oh yeah, that's what the
arresting.
topic was on.
Sorry. And when they are putting Arrestin all the time, what do you do if they want you to take out?
I would like
that
to
tooth?
arrest the dentists that are putting in Arrestin.
Okay.
Okay, that tell you? Yeah. Yes.
And what do you do to heal the gums?
I recommend in my office, I recommend in my office vitamin C sodium ascorbate version of vitamin C, not ascorbic acid, sodium ascorbate. Put it in an irrigator. In water pick, you guys know what that is? Right? And irrigate your gums every day. That kills the microorganisms, makes the ligaments healthy and strong. I've had patients who had what they call 10 millimeter pockets, and those teeth are rock hard in 3 days. Sodium ascorbate in your water pick. Right. Yes. Oh, I'm sorry. You got to get in line with the mic.
Oh, if you have a resorptive lesion, can you save the tooth?
No.
There's no saving.
No, a
it.
resorptive lesion means your body's eating it. That's what your body's supposed to do. It would eat the root canal if you didn't do the root canal. A dead tooth gets eaten also by the body. Eventually, if you have the tooth in your mouth long enough and it's dead, the root starts to get eaten, and before you know it, all that's left is a little bit of the crown up on top, and that's it.